And there was a lot of talk about when the current surge of cases in Washington will reach its peak. According to the University of Washington Health Metrics, we could soon see that peak.
KREM 2's Janelle Finch spoke with a UW health expert on what this actually means here for the next few months. Janelle?
Take a look at how the University of Washington predicted when we would be seeing the peak of COVID-19 infections. Scientists predicted the U.S. would hit its peak on January 3rd and our state would hit its peak on January 16th. Now that we're on the other side of this, one Washington health expert told me this is the beginning of the end.
It's going to get really worse before it's going to get better.
Washington health experts say the next 3 months will be the hardest on our community and health officials.
50% of our population in the state will be infected in 3 months. So all the infections of COVID-19 before Omicron will happen in 3 months. Total number of infections that we had before will happen in 3 months. What we had in 2 years will happen in 3 months, and it will overwhelm our hospitals.
But hitting peak case numbers isn't all bad. Peaks set off a downward trend of COVID cases as the disease starts to run out of people to infect. UW health leaders say the light at the end of the tunnel is just around the corner.
It will be the beginning of the end, March, April, and we should go back to what's really normal with a virus like this virus.
While Dr. Mogdad says the pandemic could see an end by March or April, that doesn't mean that COVID will be gone completely. Once the pandemic gets under control, COVID will still be around, but in a more manageable way, similar to how people still get sick from measles or influenza in seasonal waves. To break it down what we're seeing by county, Dr. Velasquez of Spokane Regional Health says King County is expected to hit their peak by the end of the month, and typically Eastern Washington follows Western Washington trends about 2 to 3 weeks later. So he says that's when we should begin to see a downward trend in case numbers on this side of the state. In the newsroom, Janelle Finch, KREM 2 News.